name is Joel Ramirez, and I work as the Chief Medical Officer for Camarena Health, a federally qualified health center in Central California. We're unique in that we are the largest provider of Medicaid services in the county. I think the pandemic really pushed healthcare to advance from a technological basis, and there were a number of advances that were made. I think the greatest hesitation for us moving over to OnSite and its TE5000 device was just moving away from what was a very usual practice. It's hard to step away from what is familiar and comfortable. We manage our medical waste as a number of health centers customarily do, and that is through a traditional hauling service. It was an inefficient model. Now that I reflect back on that, we had instances in which maybe we had very little or no waste, and yet that hauling schedule would happen as planned. It was contractually in place, and so it was difficult to anticipate when a hauling service might not be needed and cancel it in time. The TE5000 has really done away with that. In most of our clinical settings, we've eliminated hauling services entirely because we're able to manage all of our waste solely with a device. I think there's been a number of benefits since we've adopted the TE5000 device. I think one, it's created a very easy workflow. It frees up staff to be able to engage more with patients instead of having the previous process of processing our medical waste. It's also reduced the number of hands that have to handle these containers. Another benefit has just been cost savings. We've seen cost savings that range between 12% up to 70%. And that's come by way of no longer needing to have these hauling services on a regular basis and taking control of how we process our own medical waste. I think that our relationship with OnSite for the foreseeable future is one that we're going to continue to grow. In fact, it's become a standard operating procedure. Anytime that we're opening a new clinical location, we're automatically planning to put in a device there. I can certainly appreciate the hesitation for any clinical practice to consider moving away from what is a very customary, usual handling of medical waste. We had the same reservations ourselves. I would encourage any clinical practice, whether it be a primary care office, dental operatory, or specialist office, to really consider partnering with OnSite. The cost savings that we've seen, I think, can be seen in any type of setting. All medical practices generate some amount of medical waste, and so the benefits really can be had in any type of practice, be it small or large.